will AI be able to replace doctors?
If we have a serious illness, will we choose an AI tool to cure us, or would you choose a doctor?
Why we have less female doctors in India?
Girls are just as capable, taking care of families, they're strong.
Indian students who pursue their education from abroad, when they come back to India for the internship, they face the partiality.
Unfortunately, that is the truth.
A lot of countries are there.
Yeah.
Why Philippines?
Quality of education. Are you giving good practical exposure? Clinical exposure के बिना तो कोई एक अच्छा डॉक्टर बन ही नहीं सकता है.
What are some dark realities which students should be aware? They must be aware.
A lot of colleges where students are going to pursue medical education abroad, which are not giving quality education. आपको डिग्री चाहिए ले लो. Students are getting affected because of this, and they've wasted all their time, their money, whatever it is. Rural areas, you do not have enough doctors. You don't need more doctors in the rural areas.
Yeah.
You have one doctor serving multiple communities. Around 25 lakh students who are writing the NEET exam every year. 30 to 40% of them are repeaters.
People assume if you have done your education from abroad, it's not worth it. Hello everyone, I'm Avinash and I'm sitting with Kadwin here. I was having a lot of conversation with him, and the background he told me a lot of things. So briefly we'll venture into this podcast. But before I start this podcast, Kadwin, I want to emphasize that I'm not just representing myself, I'm representing students and parents who are aspiring to become a doctor. And this medical industry, like ins and out, you are well aware of it, I'm well aware of it. So I'm hoping that you'll be able to answer so that they become the actual beneficiary of it. So we'll start with the brief introduction. So please let us know about you.
Sure. So yeah, thank you so much for the opportunity as well to interact with you. My name is Kadwin Pillai. I am the director of Transworld Educare Private Limited and King's International Medical Academy. We've been working closely with foreign medical education for the better part of around 25 years. And through us, we've had close to 10,000 students who have graduated and are currently practicing in India and abroad. And of course, there are a lot of other different verticals in which we work as well. So, but yes, our primary focus is to do with foreign medical education itself.
Okay. So, what is your vision for Transworld Education and this King's International Medical Academy you have mentioned? What is the vision for that? So,
Transworld Educare and King's International Medical Academy, both through me, my father and others, is set up for one purpose only, which is to help and assist students to be able to follow their dreams, to pursue medical education and to become competent doctors, not only fulfilling their own dreams, but also helping our country as a whole grow.
Yeah. Okay. So you did mention Philippines. So I want to understand from the very starting, when we talk about MBBS abroad, a lot of countries are there.
Yes.
You can name any country.
Yeah.
Why Philippines?
Yeah, so this is something that we started exploring, like I said, around 25, 26 years ago. At that time, there were just a few countries where you would have seen students go to quite regularly. Now, before we get into that, just covering the topic of why medicine and why there is a certain limit to what is possible in India, that is what really propels students to go abroad for medical education. And when you study that, you'll be able to actually find out why Philippines also becomes a good option. So in India, ever since so many decades, we've always had a deficiency in the number of seats which are available where students can pursue medical education. Now, there are many students who want to pursue medical education, but they're unable to, either because of them not being able to get enough of marks in their NEET exam, which might be just a few marks here and there, or a little bit more, or else another major factor which can be fees.
Yes.
So fees also really affects the students. And within this itself, so you have fees and you have marks. And another major factor is that you have limited number of seats for a country which actually requires a lot more.
Yes.
So you have students who want to become doctors, a country which needs doctors, but just cannot produce. So what happens ultimately? Students then have just one option, which is to go for medical education abroad. So when they go for medical education abroad, they're going to look at those two main factors primarily, which is, fees. It needs to be a little bit more on the manageable side. And another thing is that maybe getting into the college shouldn't be as difficult.
Yes.
Okay, so these are two main things. But there is another very, very major point which I think students really need to look into, which is what really compelled us to look at the Philippines, which is quality of education. Ultimately, a student is not just going over there to get a degree or whatever it is. You can get a degree anywhere. You need to look at the possibility of getting a good quality education, and that is why Philippines really hit the mark for us. It has a lot of things, a lot of positives, which really propelled us to take it up as a priority to send students to this country. So you compare it with some of the existing countries at that time. Primarily at that time it was Russia, Ukraine, China. Of course, I'm not saying it is this as a blanket statement, but a lot of the colleges where they were going to were really not offering good quality education at that time, and that is unfortunately the case even now. So we went into these places where you get good quality, where you have good, easier language, where you have a good clinical practice available to the students, and essentially you're making them capable doctors. So if you can ensure these points, then it's a good enough country. Okay. That is what we tell to each and every one of our students. Look at the possibility of you becoming a good doctor at the end of your education. If you can ensure that, then it's a good place for you to follow. Yeah.
Like, speaking about MBBS abroad, like, it's very easy for us to discuss when we are sitting inside in a studio. But when we talk about from the perspective of a parent or a student, they have a lot of myths. So how Philippines is solving those myths? Because one of the things which I've heard from parents is it's cheap education. Yeah. Okay, so they say, like, I would rather invest 70-80 lakh rupees in India compared to sending my son to that XYZ country where they are offering education in 20 lakhs, 30 lakhs, 40 lakhs, whatever that number is. Because for them, it feels like if the education is quite cheap, like that is what they said, maybe my son or the daughter will not get that kind of an education, first of all. Secondly, they'll face hurdles in India compared to what they will face if they do their education in India. So, like, how that makes different?
So, you see, yes, definitely this is going to be something that really keeps a student a little bit away.
Yeah.
There is just not an assurity that what you are getting over there, especially with the low fees, because we always have this thing in the back of our minds, higher fees means better quality.
Yes.
That is not always the case. It doesn't matter whether it be when you're purchasing an item or phone, this, that, you'll have a phone also which can give you the same features, works just as well at a lower cost. And same thing comes to education as well. Now, primarily when it comes to medical education, there is something very, very important. Of course, there's a classroom teaching, which is very, very necessary. You need to ensure that you have good quality teachers. But also, are you giving good practical exposure? Getting good practical exposure is very, very essential. Now, Philippines, yes, one of the reasons why it has that costing advantage is, of course, the country in itself. Compared to other countries, say, for example, the US or some European countries, you might find the fees goes
a bit higher.
Very, very high.
Yeah.
Okay. In the Philippines, the economy is more similar, you can say, to India. So the costing thereby can go a lot more lower. And you have the ability for a lot of hospitals to come under one medical college. So then what happens is that our students get good practical exposure. They go to more places to study.
Yes, exactly.
They go to a lot more places to get their clinical exposure, and thereby they can become better doctors. Ultimately, medicine requires clinical exposure. Clinical exposure के बिना तो कोई एक अच्छा डॉक्टर बन ही नहीं सकता है. Ultimately, because you compare to other professions, say engineering or MBA.
Yeah.
ये professions में क्या होता है कि students, without practical exposure, they can actually complete the course. It's not necessary. It's not as high stakes as when it comes to medical education. इसमें वो practical exposure और clinical ये practice मिलने की वजह से students can definitely become better doctors at a reasonably lower cost. And Philippines is just in the ideal spot. It meets all these requirements accordingly.
ओके, फिलीपींस की बात करते हैं तो एक बहुत अच्छी बात आती है जो कि न्यूज़ भी आ रही थी और काफ़ी ज़्यादा मतलब पेरेंट्स एंड स्टूडेंट्स एम्फेसाइज, फिलीपींस डज नॉट फॉलो एनएमसी गाइडलाइंस. अब ये एक ऐसा पंच है स्टूडेंट्स एंड पेरेंट्स के लिए विच दे कैन नॉट एक्सेप्ट इट. प्लस if I'm a student and if I'm going to invest my 6 years of life in a foreign nation and probably I'm spending 20 lakh 30 lakh whatever that amount is, and if that degree is not valid, it's not worth it for me. So as a parent, as a student, if I'm looking for an alternative option and if Philippines is the option for me, how can I verify that okay, this follows the NMC guidelines? Because in internet everyone speaks about themselves. They will say this country does that, this country does that, but what kind of a ground reality we have for Philippines? So like as a parent, as a student, I can verify that okay, this is following what is required.
Oh yeah, this is a very, very important point that needs to be covered. So see now, where does this point come from, and why this came into being, and what has been done ever since, and what are the current updates which are coming up. All these things students should know. Now, starting off with the plain and basic fact, as you had rightly mentioned, a student when they are going to these countries or any place, for example, in India or abroad, to pursue medicine, they're investing quite a bit of money.
Exactly.
And more than that, they are basically spending their entire time in terms of their dreams as well, hoping to become a doctor.
Yes.
So you need to ensure that the place that you're going to is a place where you can get a degree which is valid, which will allow you to practice. That is very, very important.
Yeah.
Now, where does this point come from is because it is actually from 2021 FMGE regulation, foreign medical graduate licensure regulations, which came out, which was released by the NMC at that time. So why this regulation came out is, at that time and even now, you have a lot of colleges where students are going to pursue medical education abroad, which are not giving quality education.
Yes.
Okay, this is something, it's a very well known.
Yeah.
There is no quality education. These are almost, you can say, degree mills.
Okay.
Degree de dete hain aapko.
Okay.
Aapko degree chahiye, le lo.
Okay.
So students are getting affected because of this. A lot of students, when they are going over there, they get the degree, they come back, and then there is another exam called the FMGE,
Yes.
which you may have heard about, the Foreign Medical Graduate Examination. ये एग्जाम में students are unable to perform well. You have a very, very low passing percentage.
Yes.
और इसमें क्या हो जाता है कि when you have around 30,000 students going abroad approximately every year, you have only around 20% of them being able to become doctors when they come back.
Yes.
What about the rest?
Yes.
What will they do? So what do these students do? They have no other option but to just go back in India, look at some other profession, and they wasted all their time, their money, whatever it is, and they cannot practice. So the NMC came out with these regulations to ensure that quality is being followed when a student is going abroad to pursue medical education.
Yes.
Now, certain clauses which they came out in these were to make sure that these colleges where students are going abroad are following a similar system, at least to India, so that these students can come back to India and practice as good doctors.
Yeah.
Okay, so some of the clauses, not in order wise or anything, were duration of the course needs to be 4.5 years.
Yeah.
Okay, that's 54 months.
54 months.
Then internship needs to be done after completion of the course. Course needs to be in English language.
English language.
Subjects are supposed to be similar to the subjects which are being taught in India. And registration should be possible in the country where
they have studied.
The student is studying. So
Yes.
if you can ensure that these points are being met, then you go there. This is what the NMC said. Now, Philippines was already a part of a listing. The colleges in Philippines, they were part of an MCI listing which existed earlier.
The older entity.
The older entity.
Yes.
So before NMC, there was the MCI. So when this regulation came, what happened is that Philippines follows an MD curriculum,
Okay.
the American curriculum. We in India, we are following the British curriculum.
British curriculum.
So we follow the MBBS. The Philippines, they follow the MD. Before doing the MD, students do a pre-med course, pre-med, MD, and then they could come back to India to give the FMGE and then do the internship or whatever. Now, with this regulation, what happened is that we first thought that maybe the pre-med and the MD can be clubbed together and be considered for the duration. But NMC very strictly said we cannot consider the pre-med.
Okay.
Okay. NMC said we cannot consider pre-med, only the MD duration. MD duration is only of 4 years.
4 years.
Okay. So in 2022, they said strictly you have to do this 54 months only then we will recognize. When we took this matter up to the Philippine government, the education department, through, of course, there were many student bodies, there were us also. We took up the matter and Philippines then made certain regulatory changes. They said that the MD course can be taken up to 54 months and they came out with a circular.
Okay.
And it was released online. It is available at their website as well.
Asha, that is
It's a
available.
54-month curriculum and a year of internship.
Okay.
Okay, so this was approved and it is, of course, the link and other things are available. But during this time period itself, there was a lot of negativity which actually started spreading. And as you rightly said, अभी हर कोई तो उनके कॉलेज के बारे में तो पॉजिटिव बोलेगा ही.
Yeah.
They will try to say चलो ठीक है इधर आ जाओ, this is a better place, this that, and everybody might say negative about a certain other place. तो उसमें क्या हो गया फिलीपींस के बारे में? There was a lot of negativity
Negative PR.
and this PR or whatever it is,
Yeah.
which was being said at that time. Even though the changes, so the other regulations which I spoke about, duration and internship, that was taken care of. Language and curriculum, that was already there from before, so there was no issue in that. Even with regards to registration, recently Philippines government has made a lot of amendments and they've released circulars as well. But these changes are made over the last few years. But the negativity which existed earlier because those regulations were supposedly not being met, that still persists. And as you rightly said, it is the duty of every student to ensure that the regulations are being followed. Now, there is another point which you were mentioning, which is that NMC is not recognizing. That is not the case. So, a lot of parents think that NMC is the body which is saying कि चलो ठीक है Philippines is not allowed. ये वो वैसे कुछ नहीं है.
Okay.
In fact, right now also NMC, as you might know, they have not said anything specifically about any country. They are not going to say कि चलो ठीक है ये country गलत है,
Yeah,
ये
they're
country
simply
सही.
saying कि you have to follow the regulation, that's it. They're
Exactly.
saying that.
You follow the regulations. That is the only thing. And the only update where they've given specifically stating कि ये allowed नहीं है is with a new circular which came out
Yeah, recent circular.
very recently. They mentioned some specific
Colleges.
They
Yeah.
said कि these colleges do not meet the criteria. But other than that, they have not said this country or that country, anything is good, bad, nothing. They have said, these are your regulations. You put an RTI also to the NMC, ask specifically, they will say, make sure that these rules and regulations are being followed. And to ensure that each place is following the rules and regulations, we recommend the students to go through the country's governments, the college websites, where they specifically are they mentioning कि ये regulations follow हो रहे हैं कि नहीं.
Okay.
So make sure that those are being followed. And we know that Philippines, I can give you with an assurity with the paperwork, we'll be more than happy to show to any student who comes with us. And if you're going to other countries also, make sure that the same is being done. Make sure that those regulations are being followed because ultimately this is your life.
Yes, exactly.
This is, this is your future. This is what you are going to base your entire career on.
Career into it.
So if those are being followed, well and good.
Okay, so you did mention a very specific term, degree mill. So they are producing degree. So what are some of the dark realities like students and parents should be aware of, like specifically of MBBS abroad, because it looks very shiny,
Yeah.
Like it looks very lucrative. Like if you are going to become a doctor in like let's say 20-25 lakh rupees worth of investment, everybody would love to do that.
Yeah.
But what are some dark realities which students should be aware? They must be aware so that their parents are thinking twice before taking that decision. Because if I talk about my personal experience, whenever I talk to parents, they are sold dreams, they are sold hopes, and that does not turn out to be very good once the student takes the admission.
Yeah. So this is a very unfortunate thing that, you know, of course the NMC, they are trying their best also, and they are trying to implement some other new regulations, which I think we might discuss about that as well.
Yeah.
But unfortunately, you have a lot of colleges where essentially it's very easy for them to say ki ye hai. But when a student goes there, they realize that they are not being trained to become doctors.
Okay.
See, when a student goes to a medical college, it's one thing that, yeah, definitely you need to clear that FMGE exam to become a doctor when you're back in India. But you also need to become a capable doctor who can practice well when he goes into the field.
Yes.
Okay, because ultimately that is what you're practicing.
That is what you're supposed to do.
You're not studying to clear an exam.
Yes.
You are studying to become a capable doctor. But some of these colleges, what they do is they do not teach anything else.
Okay.
They do not do anything else. They are training for FMG.
Just FMG.
Just FMG exam. So day one you go in, they're going to start with their FMG training.
So just like we have NEET coachings where they are teaching you how institutions are saying that we are teaching you how to become a doctor, but they are teaching you how to clear FMG exam.
FMG exam. So from day one itself, they'll say कि चलो ठीक है आप FMG ऐसे clear करना है ये वो, because they do not have enough teaching faculty, or else they do not have good practical exposure. They do not have good enough facilities. So all these things really. You know, once a student goes there, now they have no other option.
They have no other options.
वो उधर बैठने के बाद तो definitely what will they do? And see, an FMG exam is not an exam which you can just study through and you know, just study day in day out for a few years and then go and pass. FMG exam क्यों implement किया है? To ensure that you can practice as a capable doctor in India. So the exam, how they actually make it is they also give some practical examples, ye wo, and now there is the new exam coming up, which is the next
exam.
That will also be implemented very soon. So why are these exams in place? They are in place to ensure that the student who is studying, who has done their course, is capable enough to practice as a competent doctor on giving the exam. So if we can give those skills to the student, if we can train them exactly about that during their curriculum itself, then that itself is what is going to get them through the NEET. The FMG, I'm sorry. The FMG, we have to remember, is just a stepping stone.
Yes.
It is just one step.
One step.
You have the rest of your life to worry about. You have a doctor's journey doesn't end over there. It's quite long.
Yes.
So becoming a capable doctor is definitely something that needs to be trained. And unfortunately, there are certain colleges where students, of course, they'll say कि चलो ठीक है, fees इतना ही है, आ जाओ, this, that, whatever it is. They'll take the student there. Once the student goes, then they realize these unfortunate truths, and then they suffer. So hopefully, the new regulations, they don't they put this pause to that.
If FMG is just an examination, why there is a kind of a thing which people say that okay, it's very hard to clear? Like if I talk to parents, they say like these institutions, they don't have a high FMG ratio. Like I understand what is an FMG ratio, I understand what is the importance of it, but for them it's just like a ratio. Like just I'll give an example. In engineering colleges, you measure a college by the size of placement it can bring. The medical institutions are measured by the FMG examination which they are able to clear. So like why students are not able to clear the examination when it is just an examination, nothing else?
Okay, so coming back, this is all related to the same point which we discussed as well. If you train a student, you know, if you make them a capable doctor, they can get through the FMG a lot more easier. Okay, it is a stepping stone because you're not training to clear your FMG, you're becoming a good doctor. Training them in the practical way, training them in the right way will definitely get them through. Now, there are colleges where, of course, you go over there, they have the theoretical training part taken care of. They may not have the practical component done properly. Some of them, they may have doctors, institutions, they may have doctors who are really not competent to understand what the Indian requirement is also in these countries. Some places there is a language barrier also, which might really, not encourage the students too much to study too well in the classroom. They have to do a lot of self-study and things. So all these factors combined together really mean that when the students come back to India, they are not really able to do too well in the FMGE. And there's another point, which is that in the FMGE exam, you have something which is called an accumulation of students failing.
Yeah.
Okay, so what happens is that the actual pass percentage, for example, you might have 70 students who clear out of 100 students in their first attempt. 30 students will rewrite the exam. Those 30 students may not have as much of a possibility of clearing the exam during the second attempt as the first one. So then they add on the next year 130 students write the exam. 30 जो fail हुए 100 नए बच्चे वापस वो accumulate होते जाते क्या हो जाता है कि ultimately you end up with a much smaller passing percentage, which is an accumulation of all earlier students who have attempted the exams again and again and as well. And that ratio seems much lower than what it may really be. So that is another way of looking at it. But yeah, training is not up to the mark in a lot of colleges, unfortunately, which is why a lot of students do not get through.
Okay. Now, if I talk about abroad, the most important aspect is the practice, the exposure, the patient flow, something like that. So, if I'll name a country, like there is no country in the world that can match the kind of patient flow we have in India. I have personally visited these countries and I can see like what kind of a patient flow they have. So, how Philippines, if I'll put in the perspective, like what kind of a patient flow does Philippines has, like it is at par with what India has, or it is something like maybe 1 or 2 patients a day, like something like that.
Okay, so that is definitely one of the biggest strong points for Philippines, the patient flow. Now, how the patient flow in the Philippines is that, in terms of population density, they are nearly identical to India.
Okay.
The cities as well, the size that you might see, they are nearly the same size where the students are going to study. So that really gives them a lot more of an advantage. You have certain European countries where the population is a lot more scant. You can say they are more spread out. And the hospitals may be a lot more smaller, where the students are generally going to practice. So Philippines, that is one of the main things which drew us towards it, which is, though of course, in terms of overall number, they are only around 12-13 crores. Okay, compared to India, that is
obviously it's a very small number.
But in the world population, if you see, that is actually very high.
Very high.
And population density wise, they are a country which can match India in terms of population density. So what happens? The hospitals where our colleges are directly tied up with, these hospitals are also a lot more larger. Now, for example, one of the hospitals which is directly associated with our college, Dawa Medical School Foundation, is by the name of SPMC, Southern Philippines Medical Center. It is the largest hospital in the Philippines. It has 4,000 beds.
Okay.
It's a massive hospital.
Massive.
So, and it's a government hospital.
Okay.
So healthcare is also subsidized over there. So you have a lot of patient inflow. By the end of their curriculum, some of our students can, they have mandatory requirements to fulfill for graduation, which is, okay, you should have by yourself taken care of so many deliveries, you should have seen so many cases, this, that and all. So on average, our students by themselves, they take care of, for example, 10 deliveries. That is by themselves before completion of the course. So they get very good practical exposure, and that is really what sets our students apart.
Okay.
Yeah.
Okay, that makes a difference. Now, one more thing I wanted to understand, like when we talk about abroad, it is, especially MBBS abroad, it is not like we don't aspire it to be. Like students think like, okay, I'm going to abroad because I could not get the option in India. But when we talk about engineering or let's say MBA, we aspire that, okay, I want to go to that country, I want to do my MBA from there, I want to do my engineering from there. So what is the specific reason behind that? And like, is it like that, like if I'm going to abroad, because you must have heard the news, like Indian students who pursue their education from abroad, when they come back to India for the internship, they face the partiality. So what could be the reason behind that, and what solution we have for that?
Okay, so yeah, that's unfortunately that is a truth.
One of the realities.
One of the realities. Yeah. It is that students who are generally going abroad to study medical education, they are not looked at in the same way.
Yeah.
So the reason for that is to start off with the students, when they go abroad, they are looked at as students who have just not made the cut.
Okay, yes, exactly.
Who have not made the cut, who have not scored enough to pursue medical education.
And that cut has to be just for government, because private institution, you just have to pay the money.
Exactly. So now, when you see the private and government ratio in India, you have around 50% which goes to the private, 50% government.
50 government.
See, a majority of the students who are going for medical education abroad are not just going because they didn't make the cut for the government, but they just do not have enough money. They do not have enough money to pursue medical education in India. You have tuition fees in India varying from, say, a package of 70-80 lakhs to around 1.5 CR, 1.6 CR even. So that is the fees. Now, that is more than a few lifetimes worth of earning for the middle class of India. So how can a person afford medical education over here? That is why they're going. But they're viewed as students who have gone abroad only because they didn't make the cut. That is not the case. So that is the first thing that really, gives them a different view. Another thing is that the points that we discussed earlier, certain colleges, they have subpar education also, which doesn't really help too much. Lower passing in the FMGE, that also doesn't help. But then once a student has cleared these barriers, when they've gone through the FMGE, the student is equally capable. Ultimately, they have written this examination. They've proved themselves as
exactly. You're a doctor.
You're a doctor. You are not supposed to be looked at any differently. You are just as capable. You are there to give your life to serve the community.
Exactly.
That needs to definitely change.
So what do you think, like, what steps government should take? Like maybe at the central level, maybe at the state level, what steps they should take so like it does not happen and India gets the adequate amounts of doctors, because without doctors we cannot survive as a country.
Very true, very true. I want to actually discuss about a very interesting point when it comes to this, which is our current doctor to patient ratio. If you actually see, we are producing around 110,000 doctors every year. Okay. Now, the government is trying to take some steps to increase that. Our finance minister had also said the possibility of increasing the number of seats.
75,000. Yeah.
So, but that might take time. And even then, I don't think we're going to be producing enough doctors, because let's compare the only other country in the world which has an equal population to India, China. You have around 2 lakh doctors being produced in China every single year. Okay? That is their requirement. That is supposed to be Indian requirement as well.
Okay.
And another thing is that these doctors who are being produced currently in India, the requirement is not just in the major cities, but unfortunately that's where the doctors are. Rural areas, you do not have enough doctors. You need more doctors in the rural areas. You have one doctor serving multiple communities. So, what steps should be taken by the government? One is ensure that the students, for the time being, because we need more doctors, and since it's going to take some time to reach that levels, if a student is going abroad, make sure that the quality is being taken care of, and the implementation of something called as a next exam. Of course, you would know about that exam as well. It's the upcoming licensing exam for all foreign graduates and local graduates as well, to ensure quality education is being served. So keeping them at par, number one. Another thing is ensuring that the colleges individually where the students are going abroad is all up to the mark.
Up to the mark, yes.
So that also, right now there is a proposal which has been set up. You may have seen that as well.
By NMC, yes.
The NMC, they have sent a proposal for making sure that the colleges are meeting, one is not just the FMGL regulations, but they're meeting certain norms. So the colleges have to apply and they'll be recognized by the NMC as well in their portal. So these will be the colleges which are specifically recognized. The students will be able to then go without this fear that, whether my degree is there, valid, this, that, or valid or not. So these two steps, implementation of the next, validating specific colleges where the students can go abroad to pursue medical education. These two will not only ensure that India has more doctors to be able to serve the community, but it will also ensure good quality
Of
doctors,
doctors.
which is both a requirement for us.
Yeah.
Number and quality, both we need.
Yes, any day I would go to a specialist compared to someone who is a journalist.
Definitely, that also is a very important point. It's not just there, you need to go beyond. MBBS is, like I said, MBBS or your FMGE next is just the first step.
Just the foundation.
You have the PG that you have to definitely think about as well.
Yes.
So all those things, India, of course, our government is working towards it.
Okay.
Hopefully, we see the results coming up soon.
Okay. Now, we discussed about abroad. Now, you did mention that China is producing around 2 lakh doctors here. And India is obviously trying, like the finance minister mentioned, that 75,000 seats were supposed to be increased. But this year, you must have heard the news, like NMC, they found irregularities in terms of the background check of the institutions, the private institutions. If I talk about myself, when I talk to parents, they said that I have submitted around 5 lakh rupees, 10 lakh rupees to a private institution before the counselling, which is not technically legal. So these are some of the dark realities of the private institutions in India. Like, what are some dark realities you have seen in your career, like which parents should be aware of these institutions? Because I'm not saying that these are not good institutions. What I'm trying to say is that we should be aware, because spending 70-80 lakh rupees is not pocket change. So if you're not getting that value out of it, ROI out of it, then it's not worth it. Like, it is better to go for other field than to spend money and just get a degree.
This is something which really is a major concern, and it's a reality of Indian colleges as well.
Especially private.
A lot in terms of the private. I wouldn't want to take the names and this as well, but you have certain colleges which are basically doing the same thing. It is a place where you can go to get a degree, because a lot of students, we have so much emphasis on an exam to get through. That once you get through, and once you've spent, say, exorbitant amounts to get in, your job is done. See, this is the most delicate and sensitive field that is out there. Medicine is ultimately you playing with another person's life.
Yes, exactly.
This is not something which can be taken lightly at all.
Yes.
Unfortunately, we have seen instances where colleges, attendance is nearly nil. I'm sure you would have seen, and we all know about these stories. You don't need to go to the college. Hospital rotations don't exist, and the hospital rotations which are there, they are in empty hospitals.
So these are colleges which are in India. These are private institutions approved by the regulatory authorities. Interesting.
These are certain these things. When the regulatory authority comes, that day everything will be well and good. But the next moment itself, you discover that things are not up to the mark. So that unfortunately exists, and when the government is trying to increase the seats number, at the same time they are trying to ensure that this very fact doesn't happen. They want to ensure that quality is also given. Just increasing a number, like we discussed, is not going to be the solution. Quality assurity is also needs to be there, and that is something which really takes time dedication, a lot of efforts which needs to be put in by the NMC, and they are trying to do that. I mean, we closely follow what is being updated and all, and definitely they are trying to ensure steps. So increasing 75,000 is just not an overnight game. It's going to take a while. Till that time, of course, foreign medical education option will be there to support that, the dreams of a few lakh more students who are just unable to get through. See, these students have not gotten into the government college because they must have missed out by a few marks.
Yeah.
That doesn't mean that they should just give up on their dreams.
Yes.
A lot of them, yes, they do start pursuing other courses as well because they know that they just can't afford these private medical colleges, which may or may not offer good quality education even. And like you rightfully said, it is just the first step. You have a long way to go. Ensure that everything is being followed in the right way.
Okay. So is it the reason that why we have less female doctors in India?
Now this is a very interesting topic, and I'm glad you brought that up as well. Yeah, unfortunately, I think that is also another truth that that exists out there, which is that we have very less, a very skewed ratio when it comes to the medical field, especially when it comes to MBBS, where you have a lot more males pursuing. Now, there are multiple reasons for this. One is, we all know that the medical journey doesn't end with an MBBS.
Yes, exactly.
It's going to continue for a lot more longer. Parents, they know this fact as well that, you're going to do your MBBS, then you're going to prepare for your PG, which might take 1 or 2 years' time. Then you're going to be doing your PG as well. Then maybe go for another NEET specialization exam. Then go for the specialization, then super specialty, this, that, whatever it is. MBBS is a field which requires studying throughout the rest of your life. And lots of people have this fear that, when a girl child goes into this, उनको तो घर संभालना है क्या?
Yes, exactly.
That's a very, very dark, discussion that they have. Because of that, lots of parents, they fear sending their students, their girl childs to go after medical education, and that needs to change. See, in the medical field, we have seen that girls are just as capable. They're just as capable of taking care of families. They're strong. They can take care if they want to. They can follow their own paths.
Yes.
They can they can set their own authority in places where it matters. They do not need to be constrained to our old ideas. That needs to change in India. Another thing is the difficulty when it comes to the profession itself. That also is sometimes a fear which exists out there. Medicine is definitely not an easy task, easy field. I always tell our students, our first batch of students, whenever they join, welcome to hell.
Okay.
Whenever they join us, because that is essentially what this profession requires you to be able to go through. It is not an easy profession. People should not think that it is an easy profession. It requires lots of dedication. It requires lots of time. It requires lots of late night hours, this, that, and all. But the people who set their minds to it can overcome it. They need to know that it's not an easy field. If you think that it's an easy field, you will never get through. That fear that it's a difficult field is what keeps a lot of parents and girls away as well. No, you're just as capable. Girls should know that out there, that they are just as capable. Some of the best doctors that we have seen are women.
Yes.
Who have gone through our college itself. I can speak to you about personally. They are some of the best doctors. Our top rankers in consecutive years have always been girls who can put in that extra effort. They are just as capable of doing 48-hour rotations, 28-hour rotations, whatever it is. You do not need to fear. That mentality needs to change. That is a reality that exists out there, that everybody is scared of sending their girl child. How will they face when a girl is working 48 hours shifts, or say for example having to deal with rude patients and violences that whatever exists, and some other unfortunate events which have been covered in national news and other things.
Yes, exactly.
All these things keep the students away, but girls are equally capable, and in some cases even more capable than even men. They have the mental capacity to be able to overcome all challenges, and that really needs to. They are equal. We are all one. If you can set your mind to something, you can overcome it. It is hell. Don't get me wrong. It is a difficult thing, but you can overcome it with determination and become the best if you set your mind to it.
No, in fact, I relate to your point. Like, obviously, they have to get married and they have to start a family. Last year, I met a parent. Like, she was a female student, and they were pretty sure that now they don't want to pursue India. Because obviously it was becoming a costly affair. Secondly, the student was actually getting aged. Like, obviously she has to look for the professional journey also, not just the MBBS part of it. They had the concern of safety measures, like when we are sending someone to outside India, like especially if she's my daughter, she's my sister, I'll think twice before making that decision.
Definitely.
And what is your take on that safety measures, especially if we talk about in terms of Philippines? So, like, how safe is it, especially for female students?
That's actually a very, very good point. Yeah, when it comes to foreign medical education, a lot of parents are worried about sending their children abroad.
Yes.
Because of safety, and when it comes to girl child or the boy child, it doesn't matter. Parents are going to be worried, especially when it comes to girl children. They're going to be staying away for a very long time. Will they be able to take care and other things? See, that's one of the reasons why we were more satisfied and we've been able to work for a very long time in Philippines, is because it is a safe country. It is a safe place. The cities which we are dealing with are ranked as some of the safest cities in all of Asia. Okay, so number one is students need not be worried about that. Another thing we need to know is that, see, these students, when they are taking this challenge up of becoming a doctor, they are setting their mind to overcome these challenges. They have to be able to be an individual who can face the realities of life as well. It is a safe place. It is a safe place, don't get me wrong. But a student, when they are going into this profession, they are also made stronger through their journey. They are made capable as well. My own sister, okay, we could have, because of our relations in the medical field and the medical fraternity, we could have spoken with other colleges and we could have gotten an admission in other places as well. But we also chose Philippines, the very colleges where we recommend students to go to, because we know exactly that this is the best place for her to pursue medical education. Now, she has completed her education over there, and she is a licensed doctor in the UK.
Okay, in the UK.
In the UK. She has completed her course in the Philippines. She got through her FMGE on the first try, and now she is a licensed doctor in the UK as well. Okay, so everybody is capable. And she studied in the same college, in the same hostels. She was in the same hostels. She did the exact same activities. Now, of course, city and everything is safe. Over and above that, we have our own hostels, we have our own caretakers to take care of them, make sure the children are able to, accommodate themselves into the medical education system and the new country and other things, that they are not, overwhelmed with everything, roles, responsibilities, whatever they have. We have our staff to take care. But yeah, children should, and parents should know that children are capable. They are capable. You need to give them the ability, give them the task of being able to find out for themselves that they can actually face life itself. And definitely, we've seen students who come in who are, fearful, they're scared, as you rightly said, marriage, all these things. Pointers are definitely things that they're worried about. And parents need to know that these things, once the student starts, once they become their independent selves, anything they are capable of. Marriage and other things, it will happen. It's not that, this can wait, this, that. Whenever they want, they can do it. Okay. but them as an individual, their self-growth, their own growth is very, very important as well.
Okay. Now, people assume if you have done your education from abroad, it's not worth it. Like this is something like come on regular basis. Now, as a student, I've invested my 6 years. I have done because that was my dream. Be it India or be it abroad, I wanted to become a good professional. So, like how would you suggest what additional courses of fellowship a student can pursue if they are doing MBBS from abroad so that they can become a better doctor? Like let's forget about coming back to India. Like let's say if they want to make a career, like your sister, she went to UK. So how was it possible? Like what she did so that it enabled her to pursue her education in UK? Like she was now a doctor in UK compared to someone who is just thinking, okay, I'll clear the FMGE exam and I'll start preparing in India. That's it.
So see, this brings up a very, very important point as well, which is that medical education, it is a course which goes for a very long time.
Exactly.
It doesn't end with your MBBS. Nowadays, everybody out there, even when we have an issue, you'll never go just looking for a general MBBS. You will look for maybe a specialist in a specific field. If I have pain in my arms, I will go to a specialist who is specifically for that itself, and ortho specialist for this. If I have my hand, for example, I'll go to a hand specialist. Okay, there's a feet specialist, there's a spine specialist. If I have a headache, then I go to a specific doctor. If I have, chest pain, then I go to a specific doctor. The medical field is expanding. It is huge. Okay, and everybody wants to go to the specialist who is an expert in that field itself. The students need to keep upgrading themselves constantly, not just with the latest information out there, but also in a specific field where they can specialize and help out people when it comes to that, because that is what everybody is looking for. They're looking for experts. And definitely we always tell the students that make your base first in India, clear the FMGE exam or whatever it is, make sure that you get your basic license. But always in the back of your head, start a preparation for further courses. India, of course, has a lot of PG options available, MS, MD, DNB, this, that, whatever it is. You can always go for it. If you want to explore other options, which we really recommend to our students as well, there are many countries which offer these courses. Preparation for these courses should always start early on. That is what we always recommend. And keep your mind clear towards the path that you want to go. Because like we said, there is just a wide array of courses. There are two directions you can approach this. One is give the exam and then find whichever course you have available for that score and then go towards it. That is an option which you can pursue.
Wrong approach, but
that is not the right approach. We will never recommend that. Make sure that you know what you are going for, what your interest is in, because you're going to look at a career growth in that. You're going to be expanding in that for years and years to come. Decades you're going to be spending in that field. We always say work is only work if you treat it as that. Treat it as a hobby, something that you like, and it can be a part of your life. It can be something that you can look at very differently. Being a doctor is not an easy job. You're going to be spending hours and hours and hours in the clinic. Your surgeries are going to be going for hours. If you don't have an interest in it, you just can't. So make sure you know what field you're going to be choosing. Even when you're pursuing your MBBS, you will already start speaking with a lot of the doctors. You are going to be communicating with them on a daily basis. Our seniors are out there as well, who can always recommend. We've had students, top rankers in the FMG almost every year consecutively. They can also recommend this, that, whatever it is. Different fields, different approaches. Wherever you go to study, always ensure that you are trying to set a path for yourself which you can follow a lot more earlier. So my sister always had this intention that she wanted to go for this course. She wanted to actually pursue a PG abroad to get more exposure to how medical systems are run throughout the world as well. So she wanted to go a little bit into the management side as well. She had that from early on itself. Practice, management, and maybe an additional course as well. So she knew that this is her path. So the steps towards these actually begin a lot more earlier than people realize. Make sure you know your path, follow the steps, and definitely it will make your life a lot more easier.
Okay.
Yeah.
Now, when I talk about FMG, when I talk about MBBS abroad, parents have this concern like, will I be able to make career in India? What kind of a jobs do I have once I have the license? Like, let's say if I have studied from XYZ country, do I have the same kind of jobs which are available for students who are in India? Do I have a separate kind of a jobs? And what sectors can I get into? Can I get into government sector? Can I get into private sector? And let's say if I want to start my own clinic, can I do that?
Oh, yes. So, yeah, this is a big concern which a lot of our parents have as well. As you rightly said, they always have that concern, what after?
Yes.
So on completion of the MBBS, of course, there is one thing that you have to start concentrating on your PG and other things as well.
Yeah.
But a stable career at that time is also very, very necessary. On clearing the FMGE, you are technically on the same level as any other MBBS graduates.
Like an Indian student?
In India. There is no difference between you. Between anybody who has graduated here or abroad. You're treated the same. You have the same license. It doesn't
At least on papers, you're treated fair.
On paper. On paper, you're treated the same. Now, when it comes to the places where you can work, we have had our graduates who have successfully landed roles in government sectors as well.
Government sector, okay.
As medical officers on clearing the exam immediately. And a lot of our students actually go towards the private side as well. Now, it depends on where you are getting this job as well. Because if you are looking in a rural area, for example, then how much work hours, what kind of work you're going to be having is going to be dictated heavily over there. The cities, of course, the government roles might be a little bit more limited. You might have a lot of the private players where you can get jobs with. Getting your regular RMO, resident medical officer jobs is generally recommended. But you can always apply for that. So majority of our students always go for those. But a vast majority of our students, what we have seen is that on clearing the FMG, of course, you have an internship to do. During that time itself, they start preparing for the PG. So you're going to be preparing for the PG. Go give the PG exam, then you can choose a career pathway there. If not, go try to get a job. And mostly our students are getting jobs in places where they can balance their PG preparation as well. A lot of times the government sectors may not truly allow too much freedom for this because you have a lot of night hours.
Yes.
Of course, you have a lot of benefits.
Yeah.
That is generally a little bit more difficult. But yeah, we've seen our students go into different kinds of professions as well. I mean, private side, government side, medical officer, or other administrative roles, but that's a little later.
Okay, so we had a good conversation about India and abroad. Now let's talk about the future. So, like, according to you, like, since you're part of the industry, you're part of the education side of it, you're part of the service side of it. So, how do you think this industry will evolve in next 20 years? Like, what is something which I am being an outsider of the industry cannot see, but you being part of the industry can see, like, this is how things will change in next 20 years?
Yeah, see, times ahead are really something which is very exciting.
Okay, it's exciting.
It's exciting, to be very honest.
I thought you would say you are nervous or like maybe bad.
No. I think you can always look at it in two different ways. You can see in a bad way or an exciting way. It all depends on your outlook. But I personally think it's very exciting, especially when it comes to medical field. We are seeing changes. We are seeing a lot of changes in terms of how it is practiced, how treatment is given. You have technology which is going at such a rapid pace. You know, it's growing exponentially. You just can't keep up with the amount of information that is readily available and what even a patient can, for example, directly get access to. Chat GPT, this, that, and all, that's also something that we'll have to talk about. You know, all these things are really out there. Medicine in itself, we have seen a growth in terms of uh, areas which are there for practice. That is what we've seen over the past few decades. Now, for example, 20 years ago, okay, when we were, a lot more younger, we would have had the concept of a family doctor.
Yeah.
Okay, family doctor concept where one doctor takes care of everything. Okay, we go to him for a headache, a fracture, mother will go for childbirth, this or whatever it is.
Everything
is taken care
we
of
have
by
a
the family.
permanent doctor.
One permanent doctor who is the go-to for everything. That has changed over time. We have 10 different doctors who we go to for different issues right now. Every family has that list. This doctor is a specialist for this. We always ask who is a good neuro, who's a good ortho, that. That has increased in a certain way. Medical treatment as well. So one is, you have more number of doctors taking care of vast number of cases. Medical treatment, the way it is being administered is also changing quite a bit. Now, even in our own medical setups, we have, for example, surgeries which can be conducted by doctors who are seated even hundreds of kilometers away, through our machines like the Da Vinci machine, which can conduct surgery.
This is happening, or like it is something?
It is there right now.
It is here.
It's existing. It's existing. So you have these machines which can actually conduct the surgeries from hundreds of kilometers away. Then you have the, also treatment in itself is changing towards not treating an illness, but more towards prevention of an illness from occurring as well. So looking at lifestyle healthcare. A lot more people are looking at making sure that how can I stay healthier for longer. Okay, so that healthcare is definitely growing as well. So you have those avenues which are growing in terms of education, where students and doctors are learning how to make sure a patient doesn't fall sick, rather than treating the illness after it occurs. So that change is taking place. And the way hospitals are also out there, that has also changed now. We have our own hospital and other things as well, but you have a lot of other medical setups which are more smaller, concentrated towards a particular field. That is generally growing a lot more. Okay, so there is so much growth which is happening, so much changes. We always say that technology and other things, that is what we've seen the maximum growth in, but the reality is that medicine is where, the field of biology is definitely where the maximum growth has taken place. In terms of us as human beings, we've seen the maximum growth in that. An illness which a few decades or maybe a century ago would have been deemed as incurable, right now can be taken care of with just a single pill.
Yes.
So it is growing, evolving. We are looking at lengthening lives nowadays. You have these influencers who are seeing the possibility of living for even 100+ years. There's that they're trying to follow a healthier lifestyle. All those changes are happening, and doctors are at the forefront of ensuring that humans can live for longer, live healthier for a lot more longer as well.
Okay. Talking about humans, there is certain thing which are making humans worried, that is AI.
Yes.
Now, AI has actually impacted a lot of engineers. If I talk about in terms of programming, personally, if I talk about now these days, if I need something programmed, I'll first go to ChatGPT. If it is not able to do it, then I'll go to the programmer. I want to understand, will AI be able to replace doctors? And if not, at what extent we can expect AI to help doctors so that they can treat their patients better?
Okay, so when it comes to other professions, I completely agree with you. It has changed it in a way where earlier knowledge may become obsolete.
Yes.
Okay, so now, for example, programming, very, very interesting topic out there. Earlier, a person had to memorize their scripts, this, that, whatever it is. Make sure you know your language properly, then only you can program right now. But right now, ChatGPT can create a much more efficient program, much more faster
Yes.
than any human being can. And where does it get this knowledge from? How can it do this? Where does ChatGPT or any other artificial intelligence actually do this from? It takes it from the existing databases.
Yeah.
Existing databases where it gets its knowledge from and then programs itself.
Yeah.
It doesn't create anything new. At least the current AI that we have cannot create anything new. It takes existing knowledge and then develops it. Okay. So, but when it comes to healthcare, there is a little difference. One is ChatGPT or other AI or whatever it is can help to enhance existing healthcare by getting that knowledge to a healthcare professional or any other person and enhance their skill set a lot more efficiently. But you or me, if we have a serious illness, will we choose an AI tool to cure us, or would you choose a doctor?
I would choose a doctor.
A doctor. Now, for example, if I have a heart attack, if a person in my family has a heart attack, will AI be my first solution to get them cured, or will I call a hospital? I will call a hospital no matter what it is. We need that human touch right now.
Yeah.
We need that human touch. We need a human being to be the first person to come when it is emergency, because AI, it can be right, it can be wrong.
Yes.
You can afford to have a mistake in your code.
Yeah.
I cannot afford to have a mistake in this. It can enhance, it can help, it can support, but it cannot replace, at least in the current scenario it is. When true artificial intelligence comes, which is not even something that we are close to right now, that is a different scenario. But the current AI that we are actually dealing with is databases which can take in, it will enhance. I will always want a doctor to be on the other side of that robot that I spoke to you about, which is taking care of my surgery. And I don't think I'll want an AI model. So just one interesting story. A few years ago, initially when AI was still closer to its infancy, there was an AI model which was being given a lot of data to be able to detect kidney stones. Okay, so to detect kidney stones, it was given a lot of images. Okay, it was given a lot of images, and they were feeding it into the system, and they were saying that, okay, fine, this is a kidney stone, this is a kidney stone, this is a kidney stone, this is not a kidney stone. Okay, and they were showing the different stages as well, okay, of it forming, so that it learns what a kidney stone is, and before it even occurs.
Yep.
When the trial actually came, when the on-field trials actually came, it was never able to detect a kidney stone. Okay, they fed it hundreds and thousands and thousands of images of kidney stones before, but when the actual thing came, it never could detect a kidney stone. The reason why is because every time they fed it an image of a kidney stone or a thing which is coming up, they always used to have a scale. Okay, scale right below, because those images, they were measuring the size of the kidney stone. So what the AI model then learned was, okay, every time I see a scale,
that is a kidney stone.
That's a kidney stone. Okay. So when they fed the real images, it was not able to detect. Okay, so this is just a little earlier. So an AI model wouldn't have been able to detect the kidney stone at that time. So this was just something that happened. Of course, they must have made changes or whatever it is. But always there is a risk. And a human being, a human touch is needed. We are all made very differently. We are not programmed to be exactly the same. Of course, though the basic principle is the same, there are going to be subtle changes within each human being. And that can only be recognized when each doctor can connect with you, not just to see physically what is out there, to be able to connect with you emotionally, to know what you are generally going through. Healthcare is not just treatment, it is human touch as well. Human touch and care, which cannot be replaced by any other machine. Care, love, and affection is also at the core of the medical profession. that is needed.
So speaking about emotions, students are quite emotional. They would rather take 2, 3, 4 drops compared to going to a private institution or going to abroad. What advice do you have for them?
So, see, if in case you are one of those students who is trying to retake, try again and again, you may be worried. You may be at a crossroad where you may have missed your cutoff by just a few marks, and that is the truth right now. You have around 25 lakh students who are writing the NEET exam every year, but almost 30 to 40% of them are repeaters.
Yeah.
Every single year, those are just repeaters who are trying again and again because they see no other option.
Yeah.
The fears that you may have for foreign medical education, I can give you an assurity that that is not all completely true. You get good quality education over here. You don't have to give up on your dreams to become a doctor. There are avenues out there. Go to a place which gives you good quality education. Choose a place which is a lot more affordable.
Yeah.
These options exist out there. You do not have to give up on your dreams. You can still pursue them. And yes, if your dream is, say, for example, an AIMS or this or whatever it is, and if you are capable, if you are just, those 2 or 3 marks below that requirement, try again for the exam. Go for it because it's going to help you financially and other things. I always tell my students, if they, for example, are scoring a 600 in their NEET in this exam, I tell them why. It's still going to be a more budget friendly option for you to get a government college in India. Try. But if you're a student who has scored a 500, because this is a one-day exam, anything can happen.
Yes, exactly.
Okay, it's a one-day exam, one time. You never know what luck you might have that day. That is the harsh reality. Your luck may have not been there. You may not get the college that you want. Don't waste your time. Time is also very, very important. See if there are options, and there are many. See what best suits you and go for your dreams.
Okay. Now, there is obviously one more stream which is getting quite popular is Ayush. So, what is your perspective on it? Like, where do you see Ayurveda, homeopathy in future compared to someone who has done MBBS from abroad?
Okay. So, this is a very, very interesting topic and a little controversial also at times, when it comes to discussion. So, see, Ayurveda and homeopathy, they have their own roles.
Yeah.
They have their own roles. I'm never going to say that, this is bad. Even in our own hospital and other places, we have doctors who have completed their field. But you should never go to a field as a second choice.
Okay.
That is something that I want to stress on. Never choose or say that, okay, fine, this is my goal. I was not able to do this, that's why I'm doing this. You're never going to be personally satisfied with yourself, and you will always have at the back of your head that fear that, okay, fine, I've not been able to, go to my true potential or follow my dreams. Never do that. If your intention was always, okay, fine, I want to become a BAMS doctor, go for it. But if you are seeing that I wanted to be an MBBS, I wasn't able to, that's why I'm doing this, don't do that. Make sure that you go after the profession, which was always your first preference. It is not, just a substitute. Never look at a substitute. BMS or BHMS doctors have their own role, which is very different compared to what an MBBS doctor is. Okay, they have their own role. You shouldn't choose this as an alternative. If that is your choice, go for it. If this is your choice, this is what you want to do, go for just that. Go for the MBBS itself. Don't look at the alternative.
Okay. One last question. What inspires you? Why you are in this part of the world where a lot of people want to do different things? Why you are in this part of the world, and what inspires you to continue that? Because obviously I do understand things are not easy.
Definitely. Things are always a challenge.
Yeah.
That's if things are not challenging you, then you're not doing something right.
Yeah. Exactly.
To be very honest, always take up a challenge which seems difficult, and trust me, you will be rewarded for it. But never give up.
Okay.
And that has been the philosophy that my father also initially had, and I also, I'm proud to say that I try to imbibe that within me also. India requires doctors.
Okay.
India requires a lot more doctors. The country needs more doctors. This is a noble profession. It's not just doctors, healthcare in general, I should say. It is the most noble of professions. I'm actually not a doctor myself. I come from a different field. But I can still say, and I'm sure everybody can agree, this is the field where you are doing directly the work of God.
Okay.
You're doing directly the work of God. You are helping another human being at the time when they are in most need of help. That is when a person goes to a doctor. When they have no other option, when they are weak, when they are down. We are trying to get the people who can help another human being, rather than us, becoming, just as I could have become a doctor myself, or my sister who is already practicing it as well. There is going to be a limit in the number of service that we can do towards this nation. This nation has given us also, we've been able to, I can proudly say that we have been able to achieve so much in our lives. How do you give back? You give back by being able to help those who are unable to pursue their dreams because of whatever reasons have been there in the past. Help them to pursue their dreams so that our nation can be helped as well. Our dream is to make sure that somehow or the other we try and create 1 lakh doctors for our nation. That is the dream goal that we have.
Okay.
Medical professionals, so many of them we want to create who can serve our nation. Of course, we have a long way to go for those goals, but we are taking the steps towards it. Hopefully other people also can all join in together. We can create this ethos, which then creates a place where people can pursue their dreams to become healthcare professionals to serve the nation.
Okay. So any final piece of advice for parents and students who are thinking of going into medicine?
Yeah. For each and every person who would want to pursue medical education, the only advice I can give is this is an option. We are providing an option which you can pursue good quality education in. This is an option. There are many others out there. There may be many others, that whatever it is. Make sure that you are able to educate yourself about exactly what is being provided in those individual colleges, if quality is being ensured, and if that's the case, whether it be them or us, always ensure that you're going after good quality, and I'm sure that your dreams will be fulfilled. Don't give up on your dreams.
Okay.
If you seem that it may not be possible to go in a certain direction, don't give up. Options exist out there. Always make sure that you pursue your dreams and give it your best shot. I'm sure you will not be disappointed at the end of the day.
Okay. So it was great connecting with you. I learned a lot of things from you. Hopefully students will be inspired, parents are able to make an informed decision, and they finally become the doctor, and they help you achieve a goal of 1 lakh doctors in your life's mission.
Yes. Thank you. Thank you so much, sir.
Thank you.
Thank you so much. Very nice speaking to you.